In 1967, John Nigerian changed organ transplants forever by exploring for a new anti-lymphocyte serum, also known as anti-rejection serum. Dr. Nigerian also organized a new training method for the surgeons and researchers in Minnesota. John Nigerian said you can turn a researcher into a surgeon, but you cannot turn a surgeon into a researcher.
In the time before 1967, organ failure was a very deadly problem. That is why anti-lymphocyte serum is very important, because before that almost all organ transplants were not successful. In 1952, in Brigham Hospital, the first successful kidney transplant was done between two twins by a man named Joseph E. Murray. John Nigerian was born in California on December 22, 1927, and now he is 88 years old. John Nigerian graduated from the University of California, San Francisco, with a medical degree in 1952 and went on to complete his surgical residency at that institution. Recognizing the opportunities in kidney transplantation, he completed fellowships at the University of Pittsburgh and the Scripps Clinic and Research Foundation. He was an early pioneer in clinical transplantation in California. In 1967, he moved to the University of Minnesota to chair the Department of Surgery and to further develop its transplant program. So far in his lifetime, John Nigerian has won the Lifetime Achievement Award and the Roche Pioneer Award and the Medawar Prize. Your body's immune system usually protects you from substances that may be harmful, such as germs, poisons, and sometimes cancer cells. These harmful substances have proteins called antigens, coating their surfaces. As soon as these antigens enter the body, the immune system recognizes that they are not from that person's body, and that they are foreign, and attacks them. To help prevent this reaction, doctors type or match both the organ donor and the person who is receiving the organ. The more similar the antigens are between the donor and the recipient, the less likely that the organ will be rejected. Tissue typing ensures that the organ or tissue is similar as possible to the tissues of the recipient. The match is usually not perfect. No two people, except identical twins, have identical tissue antigens. Doctors use medicines to suppress the recipient's immune system. The goal is to prevent the immune system from attacking the newly transplanted organ. When the organ is not closely matched, if these medicines are not used, the body will almost always launch an immune response and destroy the foreign tissue. There are some exceptions, though. Cornea transplants are rarely rejected because the cornea has no blood supply. Also, transplants from one identical twin to another are almost never rejected. John Nigerian and Richard Simmons were trying to make an anti-lymphocyte serum by mixing horse blood and human blood, by spinning it. When John Nigerian hired Richard Simmons, it was, quote, "the best choice I have ever made."
We had a full viewing room, and everybody at the University of California, San Francisco wanted to see this transplant. Jack Miley was taking out the kidney in the next room, and as a good vascular surgeon, the kidney was pristine. Unfortunately, also was a ureter. He cleaned it off just like he would clean off a vessel. it wasn't a vessel on it. And I looked at it and I went, oh my God. And I decided the best thing to do is I looked up there and all these people were looking down. I put it in. And I thought, well, maybe if it's in there and it's in the retroperitoneal space, it'll get its own blood supply and survive. And unfortunately, it didn't. And eventually, I had to take that kidney out and put another kidney in that patient. So that was the first of our beginning of a program. I left there in '67 to go to Minnesota. I looked at Barnes Hospital. The one thing I wanted to do was to continue on with this research with anti-lymphocyte serum. I thought this was the best thing for transplantation. We had Imuran, we had prednisone, but it wasn't enough. Our results weren't really that good. We were maybe at best around 50% graft survivals after a year, and less than that with cadaveric. So we learned how to grow lymphocytes. We took it back to the lab and grew our own lymphocytes, and then we inject those in horses, and ended up with the best serum that you could possibly make. Put together with prednisone and Imuran at that time, we immediately took our results 20% better than they'd ever been before. And in 1970s,
In long term, the transplant patients did not have to worry as much about organ rejection. The threat of organ failure still exists, but the anti-lymphocyte serum was a big step in stopping organ rejection. The transplant patients were impacted in a positive way. This impacted the world by making a big step in organ rejection, by making this less frequent. In long term, John Nigerian reached his objective to create an anti-lymphocyte serum. Dr. Nigerian forged one of the world's largest transplant programs, which has performed more than 6,500 kidney transplants, more than 1,900 pancreas transplants, and hundreds of heart, liver, lung, isolate, bowel, and combined transplants. A founding member of the ASTS and the fourth president of the society, Dr. Nigerian has been recognized throughout the world for his significant accomplishments and contributions to the transplantation. He remains active in numerous associations and holds the title of Professor of Surgery and Regents Professor Emeritus at Fairview University Medical Center in Minneapolis. According to the U.S. Department of Health and Human Services, last year alone, organ donors made more than 28,000 transplants possible. Another 1 million people received cornea and other tissue transplants that helped them recover from trauma, bone damage, spinal injuries, burns, hearing impairments, and vision loss.
Before 1967, many people suffered organ failure. John Nigerian revolutionized that by exploring for a new anti-lymphocyte serum. Anti-lymphocyte serum is not used as much today as a new drug called myclophosphamide acid. Dr. Nigerian encountered a new training method for the surgeons and researchers in Minnesota. He said, "You can turn a researcher into a surgeon, but you cannot turn a surgeon into a researcher."